Are you aware that breast implants come in different profiles? Not just different sizes, but different profiles. So if you're not, I think you should really watch this video. I hope that this video will really add a bit of knowledge to what you're seeking if you're looking for breast implants. My name is Dr. Amit. I'm a plastic surgeon and I have an 11-year experience in the field of breast cosmetic surgery. And what I talk to you and what the education that I try to give is basically based on the questions that you have asked me. Over the years, so many patients have asked me so many different types of questions. And these are the questions I realize are in your mind, and that's what I'm trying to answer, so that the selection of the procedure becomes very easy for you. You feel more comfortable, and if you ask the right questions of your doctor, you will probably get the right answers, and you will know that if this question is not answered, then you need to select a different doctor. So keep watching. Now, in my previous video, I hope you have seen that about sizing of the breast implant. If you have not, please see that video, because I've connected that video to this current video. Now, I had spoken of different profiles. So once we understand what are profiles, profile is basically the projection that the breast implant is able to give. For example, there's an American patient. Generally, American patients versus Indian women, American ladies have slightly broader shoulders, so they're slightly bigger build. Most Indian women are more petite, they're smaller build. Now, how that is important for us? If the shoulder base is broad, the breast tends to be larger, the base diameter tends to be a little larger. If the shoulder base is small, the breast diameter available to us is small. Now, I spoke about breast diameter in my previous video, so if there's any confusion, please go and have a look at the previous one as well. Now, if a patient is small, more petite, then the base diameter becomes less. Now, I'm going to introduce a small variability here, so just understand this. Now, the patient tells me that she wants a big breast. A second patient tells me that no, I don't want too big, I just want enough to get rid of my padded bra, and I'm very comfortable with a smaller breast. Both the patients have the same base diameter, but can we solve both their problems? Yes, that is where the profiles come into play. Now, for the first patient who says she wants a bigger breast, I would choose a ultra high profile. An ultra high profile for the same base diameter gives a larger projection. Therefore, I would then choose an ultra high profile with the same base diameter, and that will give a larger breast. The second patient, I will probably choose a moderate profile, which is not too high for the base diameter, and therefore it will not give a huge projection, but that is exactly what the patient wants. So that's how we select. Now, in terms of costings, there may be minor variations based on the profiles. Now, I'm going to give another scenario. There's a lady who's slightly more broad shouldered, and she's definitely got a bigger breast base. And she says, so two scenarios again. The patient says that, I want like really big implants. I want like 600cc or 700cc implants. I want them to be really big. A second one says that, I know that the breast base is bigger, but I don't want something which is too big, too apparent, just small, just enough. I want to get rid of the padded bra, or, I want to feel a little more comfortable in what I wear. So again, question, can we address both their concerns? Can we satisfy both the patients together? Yes. Now that's where the profiles come into play again. The first patient, we would choose ultra high profile implant, the larger the projection. So if I'm going to place the implant like this, so see, they're actually so soft. That's why I'm not able to hold them properly. Now, the larger the projection, the larger the breast is going to become. And therefore, I would choose an ultra high for the first one. And for the second patient, even though I have a larger base diameter, I would then choose a moderate profile so that the projection does not become too much. So I hope I've been clear enough to make you understand what are the different projections, how implants are manufactured according to projections. For basically it's for your benefit, because every patient is different, their requests, their demands are different. So my next video is going to talk about the breast sizing, and I speak to a lot of women who come in for breast implant consults and surgeries, and a lot of them are surprised as to how an actual breast sizing is done, because most of them rely on the bra manufacturers to tell about their size. Funny but true. So I request you to subscribe to my channel, because that allows you to know about my future videos as well, and just click the red bell on the top, so it tells you about notifications regarding my new videos. So by subscribing to this channel, you get an opportunity to keep asking me some questions, and that enriches me, and I'm able to answer better and educate myself better. So once again, I'm Dr. Amit, I'm a plastic surgeon, and have a